right, good afternoon, everyone. And as it's 1 o'clock, I think we are going to get started. So welcome to our webinar for Thursday, June 25th, I think the day is today. Our Tuesday and Thursday webinars focus on following along a live exercise session. So that's what we're going to be doing for today. I am your host. There we go. My name is Rob, one of the cardiac rehab supervisors here, and I'll be walking us or taking us through or leading us through, I guess, an exercise session. Just a couple of things to get out of the way at the start here. This is a pretty low-level exercise program, so we're not going to be pushing anything really hard, but it is designed for people who are already participating in a cardiac rehab program. If you're not part of a program, just make sure that you're medically okay to do participate safely. I'm a big advocate of trying to exercise 5 days per week, and I only do these sessions 2 days per week. So if you want to come back and repeat them for a third, fourth, or maybe even a fifth session, we do record them and store them on our website, www.cardiaccollege.ca. Excuse me. So feel free to come and check in on those later on in the week. I'm hoping with the help of Crystal to see if I can just do a bit of a generic session, maybe with some music and just only cueing a few things that people need to do, where I won't do the talk part of my walk and talk. So these exercises, they are designed to get your heart rate up a little bit and get your breathing going a little bit faster, but by no means should they cause any pain or any discomfort. If you do find you're experiencing some pain or any symptoms, please stop the exercise, sit down and relax. Hopefully that's enough to get rid of the pain. If it's not, please reach out to emergency services as appropriate. So for today, hopefully you have been and are feeling well. You don't have any symptoms, no chest pain, shortness of breath, dizziness, palpitations, or anything like that. Hopefully you've taken all of the medications that you normally would take on a regular day. And for those of you living with diabetes, that your blood sugar is at a safe level for exercise. And without further ado, let's get started with that exercise. Okay, start off just a reminder to make sure you do hydrate well. With the high humidity that we've been having the last little while, we sweat a little bit more. That sweat, a lot of the fluid in the sweat comes from our blood volume. So if we lose the fluid through sweat, it's a good idea to make sure we replace that. So hopefully people are drinking their water because that's important. All right, so before we get started, let's get a resting heart rate. So I'd like everyone to find their pulse, either here in the wrist, the radial pulse, or up here in the neck at the carotid. And if you can find that pulse, I'll give everybody a 10-second pulse count, and we can get our resting heart rate in 3, 2, 1, go. And stop. So that was our resting 10-second pulse check. Typically, our patients will have values between 10 and 16, sometimes a little bit higher, sometimes a little bit lower. At this point, hopefully you know what your resting heart rate is normally for you, and you get a nice consistent range. That's what we're after. So as long as the numbers are what you would consider normal for you, that's important. All right, so we always start our sessions off with our dynamic warm-up, which consists of 4 exercises. So that's what we're going to do. And we're going to start off with just a little bit of marching. Feel free to add some arm movement in if you feel comfortable and your balance is pretty good. The exercise that we're going to be doing today is just some marching on the spot, which is going to use our legs. So it's important that we get our legs warmed up. All right, so that's good. Let's also loosen up our hips. So hold on to something that's fairly solid and stable, gives you some good balance. I'm going to use the kitchen fridge here, and we're just going to do some hip swings. So slow and deliberate movements. We're not doing anything aggressive, just trying to get the hips moving a little bit. All right, so that's good. And now let's slowly turn around and let's do the other sides. And we normally do these for about 10 or 15 seconds or so. All right, those are our hip swings there loosened up, which is good. Let's do our ankle rotations. So feel free to lean up against the counter for a little bit of balance. And then we're just trying to do big, deliberate circles with our toe. We'll loosen up our ankles. And make sure you get both directions. And then let's get the other foot. And other direction. Okay, great. And then we'll finish off with our shoulder circles. Once again, for all of these exercises, you'll hear me saying slow and deliberate movements. They don't need to be quick and jerky and strong or anything. Make sure you get both directions. Just slow and deliberate and trying to go through what we call a full range of motion. So big circles is what you're trying to do. Okay, good. So that's the 4 exercises we do in our dynamic warm-up. Now we're going to move on to our cardiovascular warm-up. So for our cardiovascular warm-up, you want to do whatever exercise you're going to be doing, just do it a little bit slower. So we're going to be doing some marching. So our warm-up is going to be some slow marching. If I had a stationary bike here today, I would do some stationary bike for warm-up, just a little bit slower than I would normally do. And this gives the arteries supplying oxygen-rich blood to our heart the chance to dilate and get bigger. It can bring more oxygen-rich blood to that heart so it's ready for the exercise it's going to do. That's important. Likewise, we can send a little bit more oxygen-rich blood to the working muscles, our leg muscles in this case. Once again, the more oxygen-rich blood your legs get, the more work they can do. So that's important. And it also gives us a chance to constrict some of the blood vessels in and around our gut and our stomach. If we're sending more blood to the legs, it needs to come from somewhere. So typically we'll take it away from the gut. And when we do our warm-up, we like to do the warm-up for about 4 or 5 minutes. Now, from our session last time on Tuesday, we talked a little bit about blood pressure. And I was just checking my email. I saw there were two questions that I didn't answer, that I'll try and remember what they were and answer them for you now. One of them, is there a relationship between heart rate and blood pressure? Not really. We know that your blood pressure will go up for a number of reasons. Stress will do that. If you constrict the blood vessels, your blood pressure will go up. If you don't have enough to drink, sometimes your blood pressure will go down a little bit. Likewise, if you need more oxygen-rich blood for whatever reason, your heart rate will go up a little bit. But there's not a fixed percentage. If one goes up this much, the other one will go up this much. That doesn't happen. And if you want to figure out how much oxygen-rich blood your heart needs at any one time, you multiply the rate at which it beats, your heart rate, times the pressure it has to push against. Remember, that's the top number in your blood pressure, the systolic blood pressure. and that gives you a value called your rate from heart rate, pressure from blood pressure, product, because we're multiplying them together. So rate, pressure, product. And that tells you how much oxygen-rich blood your heart needs. It's a measure of work. And then the other question that had come through, and actually, for those of you at home, that's our 4 or 5 minutes of warm-up. So if you'd like to start marching a little bit quicker to get your heart rate to come up and you're breathing a little bit faster, that would be great. The other question had to do about the labeling of high blood pressure, which is called hypertension. If you've been diagnosed with hypertension, and hopefully you'll remember, if you're non-diabetic, that happens at a value of 140 systolic or greater, or 90 diastolic or greater. You've had a couple of readings at your doctor, and they've been above this value, and you've been diagnosed with hypertension. There's a number of different treatment options that you can have. We talked about some of the lifestyle ones, about avoiding alcohol and cigarette smoke and exercise and eating right and these things. And there's also a whole bunch of medications that your doctor might use to manage your hypertension. When they do get your hypertension managed and your numbers get down to good levels, are you still considered to have the diagnosis of hypertension? And I think you probably are. You will have hypertension that's well managed or well controlled. So you still have that as a diagnosis. Pretty sure that's how it works. If you're filling out insurance forms, probably a good idea if they say, do you have hypertension? Even if it's well controlled with medications, you should probably still check that box. You want to be as honest and upfront with insurance people as you can. Last thing you want is for you to fill out paperwork, and when COVID's over and we can travel again, something happens, and then there's a question where you say, oh, you said you weren't hypertensive, but you are. You just want to make sure that you're honest and upfront with your insurance coverage. So those were the only 2 questions that came in, folks. So I was scratching my head this morning trying to figure out what I should talk about while we're doing our 15 minutes of cardio here. I thought, wow, it's Thursday, Friday, it's right around the corner. Soon I'll be sitting at home with my feet up, hopefully in nice sunny weather outside my pool, having a nice ice cold beer. I'm going to say that. I thought, well, hang on. Maybe I should talk about alcohol. It's warm weather, why not, right? So, what is the scoop? What is the story with alcohol? Is it good or is it bad? So, alcohol's been kind of interesting. I've been doing this cardiac rehab thing for a long time, 26 years, and I've seen everyone say it's really, really good, and then I've seen everyone say it's really, really bad, and it's kind of flip-flopped back and forth an awful lot over the last quarter century. And ideally what we're trying to do is we like to practice what's called evidence-based medicine. So if I'm going to tell you exercise is good for you, I want to have proof, right? So it's the same thing with alcohol. And the evidence does tend to change and ebb and flow a little bit. So where do things stand with alcohol right now? Is it good or is it bad? So I'll try and answer this as generally as I can. It depends on what capacity you're looking at in terms of good and bad for alcohol. So for example, if all you care about is coronary artery disease, there is some evidence out there that alcohol is cardioprotective in terms of coronary artery disease, so blockages in the arteries themselves. There's some evidence that moderate alcohol consumption actually helps with this. So that would be a good thing. However, that's probably the only good thing that we typically find with alcohol, because there's a whole lot of negatives associated with it as well. So for example, too much alcohol is toxic to the heart muscle itself. You can develop a condition called cardiomyopathy, which is a disease of the heart muscle itself. And when you develop cardiomyopathy, they will go and take a look at the different causes of what's damaging the muscle. And you can have an alcoholic cardiomyopathy. So you can destroy your heart muscle with too much alcohol. Some people are sensitive to alcohol. And if they have a certain amount, and it varies person to person, it irritates the electrical system of the heart, and they can develop arrhythmias. That's me. I have to be really careful with my alcohol, or I develop atrial fibrillation, which for me doesn't feel good, don't like it. So I have to be careful. It's associated with high blood pressure. So we were talking about high blood pressure. If you've got high blood pressure and you want to try and control it through lifestyle without as much reliance on medications, cutting out your alcohol is probably a pretty good idea. Alcohol is very calorie dense, right? There's not a lot of good nutrients in alcohol, let's face it. So if you're trying to manage your body weight, having a lot of alcohol is something that you've got to be asking yourself about. Less alcohol, less calories, that could be beneficial as well. For diabetics, trying to control your blood sugar, it's going to be tough to do if you're drinking a lot of alcohol. And if you don't have good glycemic control over your blood sugars, that's associated with a whole bunch of poor health outcomes. There's all the psychological stuff like dependency, right? Alcoholism is very real. Impact on poor judgment, all right? So it'll affect your judgment as well. And then the other one is cancer. Any amount of alcohol is actually associated with increased cancer risk. So when people say, Rob, is alcohol good for me? Bit of a loaded question. And I mean, if I had to give you an answer on that, typically what I would end up telling people is this. If you have a reason to not drink alcohol, and as I just said, there's a lot of them, you should probably stop drinking alcohol, right? If you don't drink alcohol and you're worried about coronary artery disease, should you start drinking to help prevent coronary artery disease? I don't think so. I think the cons outweigh the pros in that one. So for non-drinkers, I don't think people should start drinking because it's a healthy thing to do. And if you are drinking and you've got reasons to stop, I would encourage you to stop. But for those people out there that don't have any real big risks associated with alcohol, and they already are drinking a little bit with no ill health effects, it's probably okay to keep drinking. As long as it's done in moderation. So people say, well, Rob, what's moderation? Well, for men, 2 to 3 drinks per day. For women, 1 to 2 drinks is probably the upper limit. All right, and by the way, you can't save them all up for a Friday night and have like 20 drinks. That doesn't count. All right, and in terms of drinks, is it like 1 beer? Is that equal to 8 ounces of vodka? No, it's 1 ounce of spirits, 1 beer. It's 5 ounces of wine. Those equal 1 serving. Okay. And for the coronary artery disease, is one type of alcohol better than the other? Generally, no. Whether it's beer, whether it's spirits, whether it's red wine, they all tend to be fairly similar in terms of the effect on coronary artery disease, from what I understand. Okay. So that's a little bit about alcohol, which means if you don't, if you enjoy a drink occasionally, it's generally not a bad thing to do. But you do have to be careful because there are negative outcomes, negative associations with it. So that's a little bit about alcohol. Now we've got another, I'm thinking maybe 2 minutes to go before we start doing our cool down. So what can I talk about? Oh, I can give everybody an update on where we're standing in terms of our program and the suspension of our program because of coronavirus, because of the COVID-19. So our last patient was on site, I believe it was on Monday, March 16th. We're June 25th now. We haven't had any patients in the building since then. For all patients that were actively in the program when we first closed our doors, we moved them into a virtual program where our wonderful staff reached out on a fairly regular basis to support people with exercise and heart healthy behaviors and answer any questions they might have. About 6 weeks ago, I think 6 weeks, we started enrolling new people into the program. into what we call our virtual cardiac rehab program. We fondly in-house here call it VCR. Remember those old VCR cassettes? So those patients are enrolled in a 4-month program where they will get phone support for exercise and heart healthy behavior for 2 months, once a week. And then the last 2 months of the program is every other week. Well, next week, we're going to be opening our doors in a very, very small, limited capacity. Next week, we're going to start testing some of our patients downstairs in our stress testing labs. Very, very small numbers, no more than 10 people a week, if that, sometimes a little bit less than that. And then we're hoping in the next month or so to be able to open up our track, also in a very, very, very limited capacity. We still need to figure out who's going to be able to come back on site. So if you see this, don't go picking up the phone, calling, saying, I'm coming back, Rob. We're not there yet. We likely won't be there for quite some time. You know, we're planning a year and a half out from now. So we're slowly starting to open. Toronto entered stage 2, I believe, yesterday. So things are starting to open up a little bit, but we still have to be careful. We know that older people with heart disease are particularly at risk of this particular virus. And you can understand in a cardiac rehab program, we see a lot of older people with heart problems. So we're being very, very, very careful in our reopening thoughts and plans. Okay, on that note, let's get our exercising heart rate. So if everyone could find a pulse at their wrists or here in their neck, make sure you keep your legs moving, sway left to right like I'm doing, and find your pulse, and I will give you a count in 3, 2, 1, now. And stop. Okay, and then just keep doing some slower walking. We'll do that for our cool down. Just like your heart rate at rest, you should be checking it regularly just to get a feel for what your normal resting heart rate is. The same is going to be true for your exercising heart rate. For some people, it might only go up a little bit, and that's fine. For other people, it'll go up more. That's also fine. You need at home to get used to what your normal response is. That way, if you get something that's really weird and different, that should have you scratching your head and saying, hey, what's going on here, okay? So that's a little bit about reopening. It's a little bit about alcohol, a little bit about blood pressure at the beginning. We've covered a wide range of things today, folks. Next week, we're going to have another session on Tuesday and another session on Thursday, and then I'm on vacation. So for the week of July 6th, I think we're going to be looking at some pre-recorded sessions because I'm not going to be able to do this while I'm out of the office. So something just to keep in mind. You can have a little bit of water, feel free, join me at home. Cheers. Now we'll just keep cooling down for about 1 more minute, folks. And then we'll do some resistance training, some stretching. I'll see if there's any questions online. And that'll be a wrap for Tuesday, June 25th. All right. Okay, good. I think we're good. So we're going to do our resistance training exercises, our 2 exercises. Legs is always something that I think everybody should be doing. It's very important. On Tuesday, I think we did our lunges. So for today, we're going to do squats. I'm a big fan of holding on to something for balance. So I'm going to use the kitchen sink here. Just going to hold on to the kitchen sink. I'm going to have my chair behind me just in case I lose my balance. I can fall into the chair instead of onto the floor. When I do my squats, I'm going to be looking nice, straight forward, lowering my bum as close to the chair as I comfortably can do, breathing regularly, and let's go and do our 10 repetitions. Here we go. Feet shoulder width apart, looking straight forward. And we'll do our 10 reps. 5, 6, and 8, 9, one more, 10. So that's our 10 squats, good exercise for our legs. And I think for our upper body today, we're going to do our bicep curls. I was talking to one of my patients, Jerry. If you're out there, Jerry, hello. He said, oh, don't do any of these fancy resistance training stuff, Rob. Keep it simple. This was after we tried to do our tricep works at the counter. So we're going to do our bicep exercises. Just get something that's got some weight to it. I always have a gym bag with me I bring to work. I just threw a few books in there, and that's going to work. And for our bicep curls, we're standing feet shoulder width apart, nice and straight and tall, and I'm just going to curl the bag up to my shoulder 10 times. 3, 4, 5, 7, 9, 10, and then let's switch to the other arm. Once again, standing up nice and straight and tall, looking forward. Don't forget to breathe. 3, 4, and you should notice that my upper arm is not moving. Just from the elbow to the wrist, I'm curling up. And that's 8, I think, 9, and I think that's 10. All right, so there are our bicep curls. And let's finish off with our stretching. So arm out in front of you, pull it across your chest, and then we'll stretch our tricep, which is the back of the arm. Stretches your shoulder a little bit too. Just a nice stretch. Make sure you breathe. Don't hold your breath when you do this. And if you can, it's probably a good idea to keep moving a little bit. Okay, and then let's do the other arm, straight out in front, cross your chest, pull it in. And we try and hold our stretches for about 15 seconds. Okay, that's good. I'll shake that off a little bit. Now we're going to stretch our chest muscles. For that, we are going to place your fingers behind your back. And if you can't reach, just get as close as you can. And then you're going to be pulling your shoulders back and looking upwards a little bit just to get that nice stretch. And for this one, do make sure you remember to breathe. Some people, when they stretch their chest, they forget. Okay, and that's good. Just shake that a little bit. Let's do a runner stretch. We'll stretch our calves. So remember for this one, both feet are flat on the ground. Both feet are pointing forwards. Sometimes it's a good idea to look at your back foot. Make sure your toe is not pointing off to the side. Should be pointing straight forward. All right, and then let's switch legs. Make sure you keep breathing. You like breathing. Excellent. And then we'll finish off with everybody's favorite hamstring stretch. So just get in your chair. Don't sit all the way at the back. Keep your bum kind of scooched forward a little bit. One leg straight, the other leg bent, and then we're just going to reach forward towards your toes as far as you can comfortably go. And you'll feel that pull through your hamstring, the back of your leg. Don't forget to breathe. All right, then let's switch to the other leg. Forward. You want a little bit more of a pull. If you pull your toes up towards the ceiling, you'll feel a little bit more of a pull if you want a little bit more of a stretch. All right, and that looks good. Grab my water bottle, come up to the screen, and let me see if there's any questions here. Look at that, nothing in the chat, nothing in the Q&A. So that means I could just bring up my slides. Let's see what's going on for Monday. So for Monday, yeah, Dr. O, our medical director, he's going to be talking about what's in the latest news about COVID-19 at 1 o'clock. So if you'd like to tune in for that, those of you that have heard Dr. O speak before know he's a wonderful speaker, brilliant guy. So I'm sure that'll be worth catching, especially we get some nice updates as things are always changing. So that's one. The Women with Heart, which typically happens on Tuesday morning, next week they're taking a week off. So after Dr. O's session on Monday, the next session is going to be little old me on June 30th at 1 o'clock. So feel free to tune in for that one. Let me just see. I think I saw 1, 2 questions. Let's just see what they are. Thank you, Rob. Thank you, Rob. Folks, you are very, very welcome. I'm glad you find these sessions useful. All right, folks, I'm going to leave this open for another minute or two. If anybody has anything you'd like me to talk about next week, Tuesday, let me know. I'd love some questions or topics because I'm running out of things to talk about. So feel free to put that in there, okay, folks? Stay safe, have a wonderful weekend, and I look forward to seeing you guys again on Tuesday. All the best.